Make informed choices when it comes to your health care coverage. Bill Green is joining us again. He's the owner of Green Insurance. Welcome back to First Coast Living.
Thank you.
And since we are in the Medicare enrollment, what trends are you seeing currently?
For a lot of our clients, they're staying put for the most part, depending on the plan they're on. Usually year over year, the plans don't change a whole lot.
Okay.
We are talking to a fair number of folks, though, who are getting unsolicited calls about Medicare, which happens all the time. And I've had several of my longtime clients who maybe are a little more susceptible to being talked into things, change into a plan that just doesn't have their doctors or medicines in it. So they call me to make sure they do the right thing, and then we're able to fix that because we're still within that time period.
Okay, good.
So don't answer those unsolicited calls.
And what other advice then would you have for someone who maybe hasn't chosen their plan yet?
Even if you're happy with your plan, still shop and make sure it's the best fit for you. Like I said, a lot of our folks are staying on their same plan, but some of them, it just makes sense to make changes to either get some more extra benefits, lower costs, lower copays, or save on their monthly premiums.
And do you have any resources, I guess, then for groups who may want someone to come in and talk to them about all this?
Absolutely. So I have several presentations we can come in and do. Just Medicare 101s, why it's important to shop your Medicare plan, and then we have another one that is how to save money on costly medications.
I mean, I know all of this can be so confusing to people, so I didn't even know that that was something that was offered, which could definitely help a lot of people. And of course, we want to change it up a little bit. Last time we spoke, you were talking about, I want to make sure I get this right, Bright Health was leaving Marketplace. How has that affected people, or how is it affecting people right now?
I was on Bright Health myself last year, and I just haven't gotten around to changing my own plan yet. So I was automatically moved over to another company called Molina.
And all of them would be basically moving over to that?
That's what we've seen so far.
Okay.
However, I was not kept as the agent on my own policy. So make sure you reach out to your agent if you have Bright Health, or if you don't, you signed yourself up, or you've never heard from them ever again. Reach out and we can help make sure maybe that Molina plan is a good fit for you.
Right. And then
but if not, we can help you shop and find the right plan.
Okay, what about Aetna?
Aetna is another one that's new to the marketplace this year. We've done quite a few Aetna enrollments, and they tend to have low costs and a good network.
And then you mentioned that some people may end up with higher out-of-pockets on their marketplace plans. Is there anything they can do to offset? Yeah,
so there's really two ways the marketplace works. One is you get a substantial tax credit or subsidy. You tend to have really lower costs. If you don't get as much tax credit, or you have to pay the full price, you can have higher out-of-pockets. There are some plans that have been built and designed specifically to go with the marketplace to help offset those costs if something catastrophic happens. Things like an accident, a critical illness, or hospitalization. They're designed, again, specifically to go with those plans to offset your big out-of-pocket costs.
Okay, well, if somebody does want some help, maybe they want to reach out, how can they get in touch?
They can call the office, which is 904-717-1176, or they can visit our website, greenins.com.
All right. Well, thank you so much for joining us today and telling us all about it.
Yes, thank you.
Of course. And if you'd like to see this segment again, just head to our website at firstcoastliving.net.